Aloha and welcome to our Kokua Council members, our invited guests, and our board of directors. My name is Greg Misakian, and I'm the current president of the Kokua Council. Today is Monday, April 22nd, and we are pleased to have presenters from the Hawaii State Health Insurance Assistance Program, also known as SHIP, and the Hawaii Medical Service Association, also known as HMSA. They will be presenting information on Medicare, which we hope will be informative and helpful for our members. I also want to recognize our former president of the Kokua Council, who's here with us today, Lila Mower, who has done so much for our membership in the community over the 4+ years she served as president and over the 6+ years on the Kokua Council. Lila chose to step down as president due to other commitments, and we are grateful that Lila has chosen to remain on the board. At our last board meeting, the board recognized Lila's contributions and accomplishments by appointing her president emerita. I've asked Lila to host today's program, and with that said, I will hand it over to her. And we thank you again for all who showed up today to participate in this presentation. Mahalo.
Mahalo, Greg. Good morning, everyone. I'm Lila Mower. Welcome. Good to see you all. We've done a few of our general meetings in person, but today we've gone back to our Zoom method. At any rate, it's nice to see all of these familiar faces. We're going to begin our program with Hawaii SHIP, Hawaii State Health Insurance Assistance Program. And I ask Candace, Lani, and Jazlyn to begin the program. If you will, could you please give us maybe a short introduction about each of you? Thank you.
Sure. Lonnie, before we get started, should we call in Caroline? Caroline, did you want to say a message about EOA before we start?
Hi, Candace. Yes, thank you. Yes, I'm Caroline Cadirao. I'm the director of the Executive Office on Aging, and happy to be able to have one of many programs here at the Executive Office on Aging presenting to all of you today. As most of you are pretty much aware, the Executive Office on Aging is the state unit on aging here in the state of Hawaii, and we provide long-term services and supports to older adults, caregivers, and individuals with disabilities throughout the state. And just happy to be here. I'm so glad that the drilling above my head just stopped about 2 minutes ago, so I was able to do this short introduction, but I will just turn it back over to Candace and Lani and Jazz. Thank you.
Lonnie, do you want to go ahead?
Good morning, everyone. My name is Lani Sakamoto. I'm the supervisor of the Advocacy, Education, and Outreach section within the Executive Office on Aging. I oversee 3 different volunteer-based programs. One of them is Hawaii SHIP, and I'll pass it over to Candace Nakamoto, who's the volunteer coordinator of Hawaii SHIP.
Hi, everybody. Thank you for having me today. Like Lani mentioned, I am the volunteer coordinator for Hawaii SHIP. I've been with the program for over 6 years now. So I manage all of the volunteers, and then I'm also the Medicare Improvements for Patients and Providers Act director, which is a separate grant that we receive to support SHIP work to help those who are really isolated, speak English as a second language, maybe have low income, low assets, qualify for financial assistance programs. And I'm going to hand it over to Jazz.
Hello, everyone. My name is Jazlyn Wandasan, and I am the Hawaii SHIP Interim Director. I just got on board for the since February. So I'm here mainly to support Candace, help run the slides for today, but I'm also eventually going to be taking a step forward and helping out to expand the program and their services. Thank you for having me.
Right. Should we go ahead and pull up the PowerPoint?
Yes, please.
Okay. All right. So we're going to go ahead and get started today. So thank you for inviting us to share information about the Hawaii SHIP program and about Medicare. You will receive a copy of today's presentation and a list of Medicare amounts after today's meeting. It'll be sent out to you. Please feel free to chat your questions during the presentation. We will have time at the end of today's presentation to address any questions you might have. All right, so in today's presentation, we're going to discuss the SHIP program and services. We're going to then provide a brief overview of Medicare and then highlight new Medicare changes for 2024. So Medicare information is important, especially since Hawaii is an aging state. With over 1 million residents, almost 300,000 people have Medicare. And we can attribute this large older adult population to a high life expectancy with an average of 80 years old. And it's projected by 2035, when the last baby boomers reach retirement age, about 1 in 3 people in Hawaii will reach the age of 60 years old. So we are an aging state and a lot of folks will have Medicare. We're going to provide some Medicare statistics for you in the next slide. Medicare has certainly come a long way, since you can see it was signed into law in 1965 by President Lyndon B. Johnson. Over the years, Medicare has expanded to include coverage for those under the age of 65 that have certain disabilities or certain health conditions. In 1999, Medicare Plus Choice was launched. We know this as Medicare Advantage or Part C. And not until the early 2000s did Medicare include prescription drug coverage. And a shocking fact at the bottom there, in 1965, Medicare Part B was only $3. And today it's at least $174.70. So that's over a 5,000% increase. And we can only expect premiums to go up as well. Okay. So you can see Medicare is really confusing, and SHIPs are here to provide, help and information to demystify Medicare, the confusing world of Medicare. SHIPs are located in every state, and Hawaii SHIP has been a program in Hawaii for over 30 years now, since 1992, providing Medicare information and education. SHIP stands for the State Health Insurance Assistance Program. We are a federally funded, volunteer-based program under the Hawaii Department of Health Executive Office on Aging. Our former name was Sage Plus, and we were branded to Hawaii SHIP in the early 2000s. So some of the services that SHIP provides, we provide free, local, confidential, unbiased, and timely Medicare counseling. It's important to mention, like we mentioned in the beginning of today's program, SHIP is not affiliated with any health insurance companies, and we don't sell insurance. SHIP is just a trusted local resource to help you navigate through the rough tides of Medicare. If you need assistance with counseling, you can call our pre-recorded helpline at 808-586-7299. We ask that you leave a message with your name, your number, or an email, zip code, and best time and day to reach you with a brief message of why you're calling. Or you can go through our website and place an inquiry at hawaiiship.org. A volunteer counselor will call you back within 5 business days. It's usually less than 5 business days, within a few days. Counseling can be conducted over the phone, in person at our office, or via Zoom. In addition to counseling, we also provide presentations for community groups. So we conduct presentations for groups of 5 or more people, and this can be in person or online. We have over 15 different types of Medicare-related presentations. If you're interested in learning more about Medicare and Social Security benefits, I just wanted to plug an upcoming presentation. We're conducting a virtual joint presentation with Social Security. It's entitled Project Grad 65 on June 3rd from 10 to 12. Social Security will present from 10 to 11, and then SHIP will do the Medicare basics from 11 to 12. You can register by clicking the link, and this will be provided to you when you get a copy of the slides. The presentation usually fills up pretty quickly. We have over 100 participants every time we offer it, so we hope that you can join us as well. And then finally, SHIP distributes information, Medicare information and resources at community health fairs statewide. So if you see one of our friendly volunteers in blue, please drop by our table and they'll be happy to assist you. One of the other services SHIP provides is finding beneficiaries cost-effective health plan options that best fit their individual needs. So we run things called plan comparisons. So we can compare plan options for Advantage plans, also known as Part C, prescription drug plans, or Medigap plans. We collect the beneficiaries' listed medications, their preferred pharmacies, and their preferred insurance plans. Then we enter this information into this Medicare comparison site online. And then we highlight the 3 most comprehensive plans and provide an explanation on what we did, and then provide a side-by-side comparison of those 3 plans, as well as details for each plan option. This allows people to make an educated decision on what they want to sign up for. So this is a very good service, especially during open enrollment when a lot of people are trying to change their plans. This plan comparison could be very helpful for them. Okay. And then the last service I want to highlight is financial assistance. As you can imagine, Medicare can be very costly. Hawaii SHIP screens beneficiaries for potential eligibility for financial assistance that can help them pay their Medicare premiums and provide additional benefits. Those who meet income and resource limits might be eligible for financial assistance like Medicaid, Medicare Savings Program, or Extra Help. Although we don't deem eligibility for these programs, we can explain what the financial assistance programs cover and help people to apply. And those who are already receiving financial assistance, if you know people who have Medicaid, MSP, or Extra Help, there is a process called redetermination for those who are already on Medicaid or those programs. You might know of people receiving letters from MedQuest, the local Medicaid office, and oftentimes these letters can be confusing and people don't really know what to do or what information to submit. So if you know of people who have to submit information, or maybe they were informed that they're losing financial assistance, have them call Hawaii SHIP for help, and one of our volunteers can help them reapply or submit the necessary documents to MedQuest. So now that we went over SHIP services, let's discuss Medicare basics. So Medicare is essentially health insurance provided by the federal government. You can receive Medicare in a few ways. One is age-based, meaning that you are 65 years or older. You can also receive Medicare under the age of 65 if you have Social Security Disability Insurance, SSDI. If you were on Social Security Disability for 24 months, the start of the 25th month is when you would automatically get Medicare. Or you can have Medicare based on certain health conditions, such as end-stage renal disease or kidney disease, or ALS, also known as Lou Gehrig's disease. Upon diagnosis, you can qualify for Medicare. Unlike Medicaid, which is discussed in later slides, Medicare is not based on your income or resources. These are possible ways you could qualify for Medicare. Okay, this next slide visually depicts the different parts of Medicare, and I'll go over each aspect. Think of Medicare as like 2 separate rooms, and behind the first door is original Medicare. And this consists of Part A, which you can see says hospital insurance. It covers your inpatient services, short-term skilled nursing facility care, up to 100 days. Medicare does not cover long-term care, but it will provide that short SNF stay after being hospitalized. It covers hospice care, end-of-life palliative care, and home health care. People who have worked in the United States and contributed to Social Security taxes for 40 quarters, so that's equivalent to about 10 years or longer, can qualify for premium-free Part A. So either them or their spouse. And this 10 years, this 40 quarters is not consecutive, it's cumulative. So if you have Medicare also due to a disability, that SSDI, or end-stage renal disease or ALS, you can qualify for premium-free Part A. Let's just say you don't have that work history, or your spouse doesn't have that work history. You can still purchase Part A. It's rather expensive. if you have 30 to 39 quarters, you would pay $278 a month. And if you have less than 30 quarters, it's $505 a month. So usually when you register for Medicare, Social Security will tell you how much work quarters you have and how much you are going to pay for Part A and B. The next part is Part B, which is your medical insurance. This is your outpatient coverage, such as doctor's visits, emergency room. Durable medical equipment are like walkers, wheelchairs, hospital beds. There's a whole list of DME that Medicare will cover. And preventive services. An example is like your annual wellness visit or flu shots or even other health screenings. Everybody for Part B has to pay a premium. There's no premium free option. And the base rate that a minimum everybody will pay for is $174.70 this year. And this is per month. Those people who have a higher income, it's called an IRMA, an income related monthly adjustment amount. These folks will be paying a higher Part B premium, more than the $174.70. So if you as an individual make more than $103,000, or as a couple more than $206,000, you will maybe pay a higher premium in an IRMA. So Social Security will calculate that based off of your reported income tax from 3 years prior. So if you do have any changes, there are forms you can complete with Social Security. For example, if you retire and your income is different, they can readjust that premium for you. So that was original Medicare A and B. And with original Medicare, it's important to pick up prescription drug coverage because Part A and Part B will not cover all of your listed medications. So for Part D, prescription drug plans, the premiums range from 50 cents to over $100 this year. So it just depends on what type of drugs coverage you're looking for, and that kind of determines how much you would pay for your premiums. Each drug plan has a list called a formulary. So you want to definitely check if your drug is covered on the formulary before you pick a prescription drug plan. Medigap, if you see there, it's a Medicare supplement insurance policy. So Medicaps are basically sold by private insurance companies to offset your out-of-pocket cost for Part A and Part B services. So usually Medicare is an 80-20 relationship. So Medicare will pay 80% and you pay 20% of services. So if you have a Medigap for the Part A and Part B services, if you have coverage, the Medigap will cover the 20% out of pocket. But you do need to pay additional premiums to get this Medigap policy. Usually your original Medicare will pay primary, and then your Medigap will pick up whatever's remaining from that plan. Okay. And behind door 2 is your second option. So you can choose one or the other, original or Medicare Advantage. Medicare Advantage, as we mentioned, is also known as Part C. So they're kind of interchangeable names. And Part C is an alternative option to original Medicare. So it's going to cover the same things as original Medicare and more, because Part C plans are sold by private health insurance companies. And in order to choose a Part C plan, you would need to first have Part A and Part B. They're going to require your Medicare number to sign up for an Advantage plan. And almost all of the Advantage plans includes prescription drug coverage bundled into the plan. So it's not like you would have to pick up a separate prescription drug plan. So for example, the different Part C plans in Hawaii are like HMSA, Kaiser, United Healthcare, Humana, Devoted Health, and WellCare by Ohana. So all of these different insurance companies sells certain Medicare Advantage products. And the plan premiums range from $0 a month to almost $200 a month, right? So a $0 plan benefits are going to be different than a $200 plan benefits. So it just depends on what services that you're looking for and if it's covered by the plan. And also look at that drug formulary for the Advantage plans to make sure that your prescriptions are covered. So that's kind of the broad overview of the different parts of Medicare. So now let's talk about some of the changes with Medicare this year and what to look out for. So there's a thing called Inflation Reduction Act, IRA, and this law passed in 2022 to lower prescription drug costs for people on Medicare. So they're rolling out new benefits every year for a 7-year period. So we kind of put a timeline there for you. In 2023, select insulin was capped at $35 a month. So a lot of people in Hawaii are diabetic. So now this will lower their insulin costs. So they should check with their health plan to see if their insulin is covered at $35. It also eliminated the out-of-pocket cost for vaccinations. For examples, like the shingle shot is usually a typical vaccination that is 2 shots, pretty expensive. Now with this new Inflation Reduction Act, there is no out-of-pocket cost for shingle shots. In 2024, basically they reduced the out-of-pocket cost when you're in the final stage of drug coverage. So depending on how much medications you take, how much money you spend out of pocket, you might hit what is called catastrophic coverage. And this means that you have spent more than $8,000 out of pocket for your prescriptions, paying for like deductibles, paying out of pocket costs. And for those who have really expensive medications and they've hit that $8,000 threshold, they will not pay anything for the remainder of the calendar year. So previously, they had to pay 5% of the cost, but now they have to pay nothing. The Inflation Reduction Act also made it easier to qualify for the Financial Assistance Program Extra Help. This is to help pay for your prescription drug premiums, co-pays, co-insurance when you go to the pharmacy to pick up your medications. So really good things happening. And then just to mention on the next slide, you can see here in 2026 that there were 10 medications that were negotiated for prices. So in 2023, they selected those medications that they're going to negotiate prices on. So if you see your medication on this list, new prices will take effect in 2026. And these medications were kind of known to be pretty expensive. So hopefully with this new change, the drug prices will go down. Moving on, there's more changes with Part B specifically. And so I'm going to highlight a few of those changes. So telehealth uses audio and visual technology to provide access to healthcare services. For example, if you use telehealth to have an appointment with your doctor on a video call, like on Zoom, for now until the end of this year, you can continue to receive telehealth at any location. So this includes doing the calls from your home. In 2025, there will be a change. In order to get telehealth covered, you need to live in a rural area, and you can only do the telehealth appointment from a medical office or a facility. It can't be from your home unless you have ESRD and you need home dialysis. If you are diagnosed or treated for a stroke, you're treating a substance abuse disorder or mental health disorder. For those select situations, you could get telehealth services in the home if you live in a rural area. So major change to the accessibility of telehealth in 2025. But for the rest of this year, the benefit will remain that you can use it in the home. Part B will also cover chronic pain treatments. So chronic pain is described as like a persistent or recurring pain that lasts more than 3 months. So Medicare will cover a pain assessment, medication management, and care coordination and planning. So this is a new benefit covered under Part B. So you could talk to your doctor about these screenings and Medicare now covering it. And then finally, mental health services have been expanded under Part B. So Medicare now covers mental health services provided by a marriage and family therapist and counselor. So this includes coverage for partial hospitalization. So this is like an outpatient day program and intensive outpatient program services. So still an outpatient, but an increased level of assistance. And then Part A has always covered like inpatient mental health services that's provided in a hospital setting, but they just expanded it to an outpatient setting for mental health services. As you can imagine, Medicare is very confusing. We will provide you a chart of the Medicare amounts, what parts cover how many days and how much it costs. And it's really important to stay up to date about these Medicare costs and benefits because they change annually. And over the years, SHIP has expanded our services and volunteer team to kind of keep up with the demand. However, more staff is needed to sustain the level of support for our growing aging population. So in 2023, SHIP and our sister program, the Senior Medicare Patrol, we had 2 bills going through the ledge sesh. This was our many attempts of trying to get funding, but we were happy to report that both bills have passed last year, and we were awarded funding to hire additional staff. So we look forward to providing more services and supports for Hawaii's Kupuna with these additional staffing positions. So if you have any additional questions, you can give Hawaii SHIP a call. You just leave your information on our helpline or our website. So our helpline is 808-586-7299, or visit our website at hawaiiship.org. At this time, I'd be happy to address any questions that you might have about Medicare or the SHIP program. I see Doug, your hand's up.
Yeah, I'll ask a question.
Sure.
Yeah, thanks so much for doing this. Really appreciate it. It's really complex. And let me ask a question about what kind of questions we can ask, I mean, make an appointment for.
Mhm.
And let me just use my situation. I'm 71, I'm on Medicare. I'm employed full-time. I'm going to leave full-time employment. They're going to cover me through June. And I have this Kaiser plan that's great. I want to keep it like that. When do I do what and that sort of thing? I'm going to go to Germany in June and then come back in July and find something else to do, either employment, hopefully, or some other kind of thing to make a living. So would I make an appointment? And I've heard people, and actually Kokua Council has done programs on Medicare and that sort of thing. And I still don't completely understand. People are talking about Medigap, the donut. I don't understand what the heck that is. So I would make an appointment with you to tell me when to do what and what I had to do in order to maintain coverage and that sort of thing.
Yeah, definitely. If you're thinking about maybe retiring in June of this year, right?
Right.
At least start planning and learning about Medicare at least a couple months before retirement.
Right. Which is right now. And I'm not
Right.
really thinking of retiring. I'm leaving my current employer and coming back and trying to find something else to do because I can't live just on Social Security. So
Right. That's usually the time when you can start planning if you want to pick up Medicare. Did you pick up Part A yet?
So I'm on Part A, I guess, right? Isn't that automatic?
Are you collecting Social Security?
Yes.
Okay, so if you collected Social Security, they auto enroll you into Part A and Part B.
Right. I'm paying X number of dollars for Part B.
So you have Part B as well.
Yeah. And then I have Kaiser, which I want to keep. And I don't know what, the border lines between things and that sort of thing. So I would, rather than take up other people's time here, I would make an appointment.
Yes.
You would suggest I do that. The sooner the better, I guess, right?
Yes, give us a call and the counselor will kind of walk you through what you need to do, what your plan options are, and then help you along the way.
Perfect. Thank you much for that. I see other people with their hands up.
Lila and Greg, I see hands up.
Hi, this is Lila. Let me lower my hand. You said that at the end of 2025, telehealth for urban
Yes.
areas will end. And I'd like to know the rationale for that. A lot of Kapuna find telehealth very convenient. Of course, there are many health situations where you actually need to do a hands-on examination. But for many issues, telehealth is very helpful. That's my first question. Why are we ending that? And then the second question, I had heard that people who are incarcerated
Mm-hmm.
lose their health insurance
Yep.
benefits.
Mm-hmm.
And so what happens in that instance? And how do they regain it once they're through with incarceration? You know, how quickly can they regain health insurance? Because a lot of people need, of course, medical coverage. Thank
Right.
you.
For the reason of the telehealth change, I'm not completely sure why Medicare decided to change the structure. I know that especially during COVID, telehealth was very convenient for people, especially if you're unable to go to a doctor's office to be assessed. Lonnie, do you have anything to add about the telehealth change?
Yeah, we don't, all we do is convey the changes that are coming down the pipeline. We don't necessarily understand the rationale that happened, but we make sure that folks know ahead of time so they can work with their doctors. And if they do have some limitations in terms of physically seeing their doctor, then they can work it out. I'm sure there's exceptions to that coverage, but for now, that's what we've been told is until the end of 2024, telehealth services will be covered. But after that, there will be changes. Also, in terms of your second question regarding incarcerated individuals, a couple of years back, Candace and I visited OCCC. And we, several years later, we have developed a toolkit for those who are being released and need to sign up for their Medicare coverage again. So Candace, I'll let you go ahead and elaborate on that.
Yeah. Previously, those who were incarcerated, they qualified for a special enrollment period once they got released for prescription drug coverage. So they always had creditable health insurance that way. But when they got released, they didn't have creditable insurance for Part B of Medicare. So they would likely be hit with a penalty upon signing up late. But recently, I believe it was in 2023, they created a special enrollment period for those who are being released to sign up for Medicare and not get penalized. So they're kind of now paying attention to those who are being released from incarceration, creating more awareness about what to do. And I'm part of a national work group, Incarcerated to Insured. And so they're working on like toolkits and spreading information nationwide about resources for those who are formerly incarcerated in Medicare. I hope that
Great
answered your question,
questions.
Lila. And then
Yes, it
Greg?
did. Thank you very much.
Lower my hand also. Okay. By the way, Candace, excellent presentation, and we really appreciate. You know, it's a high level overview, but actually it's more than that. So it's a very good presentation for us to understand a lot of the elements to navigate. I'm not quite of age yet, so I'm a couple years away from 60, but I am keeping track of what's on the horizon, so I have to watch that. So I have a question regarding a kapuna that lives in my building, and I was surprised to hear he's in his 70s. I was surprised to hear that he doesn't have health insurance, and I was a little bit disturbed hearing that because in your 70s, if something happens, you know, you need to have a, a way to protect your assets. He has a condominium here in the building that I live in. I do know he has some financial resources, but he said he does not collect Social Security. He didn't really put money into it as he was younger, so I think he was working for a family business and maybe directly from, you know, for the family without getting a paycheck. So maybe just part of the family money that was coming in.
Right.
So I don't know how that went, but say he has financial resources and say he owns one or two properties. I think there might be a second property. If that's the case, for him to get onto Medicare, how does that even work? Is that a possibility?
So financial limitations are for Medicaid. So Medicare, it doesn't matter how much income or assets you have. It's age-based, so at least, if he wanted to pick up Medicare, he would have to do it during the general enrollment period. So that's January 1st to March 31st, because he's past that initial time where he could have enrolled. If he has that 40 quarters of work experience, then Part A would be free. If not, he could pay to get Part A. And then the Part B, he could pick that up as well. There might be lifetime late enrollment penalties if he didn't have any other insurance. It's possible maybe he has retiree insurance from a former employer. So he might have that type of insurance. And then if he qualifies, Hawaii Ship can screen him to see if he might qualify for income or assets for the Medicaid, MSP, or extra help. And if he does get those assistance, it will eliminate his late enrollment penalties. So they actually pay for the penalties for Medicare. So it might be worth reaching out and just seeing what's available to him and what he might want to do.
Okay. So for the moment, it sounds like the enrollment period has passed, so he would have to wait until next year to officially enroll.
Correct, unless he has like any special circumstances where he like lost insurance or that kind of thing. Because Medicare has like set enrollment timeframes where you can do certain things.
Okay, thank you very much for that. And then I think, Lila, I'm going to turn it back over to you if you want to have any closing statements.
I have one more question then. For someone who, similar to Greg's situation, for someone who doesn't have Medicare and may not be able to qualify for Medicaid, are they able to purchase insurance, health insurance from, just as a for instance, Kaiser or HMSA?
There is a thing called the Health Marketplace, healthcare.gov. So if you're not eligible for Medicare or you don't qualify for financial assistance, you can pick up like individual health plans through the healthcare.gov. And there's even some subsidies where it can lower the premiums of the health plans. So that's also an option.
Okay, great. So we've gotten really good information from you. We look forward to receiving a copy of your PowerPoint presentation and the link where we can ask the phone number for questions and maybe the link for the Medicare comparison.
Presentation.
Yeah.
Oh, yep.
All those things. That'd be wonderful. And again, if you could please repeat your phone numbers where people can contact you, I'd really appreciate it.
Okay. 808-586-47 808-586-7299. And then you can go to our website, hawaiiship.org, and then Jazz can pull that up for you guys on the final screen. Lani, did you have any last minute comments?
No, I think we had some really, really great questions asked, and we're here. We pretty much provide counseling 24/7. Our volunteers are absolutely amazing. We have over 100 Medicare counselors across the state, and we make sure that every client gets to talk to someone who's in their community and familiar with the doctors and the pharmacies and so forth in that area. Each island has its own unique challenges. So we are an expanding program. The calls last year alone were over 6,000. So we're doing our very best to keep up with the demand. We have not, knock on wood, had any issues or complaints since 2016, and I think that's a huge statistics that we want to make sure that we share. Pretty much what you're seeing here is our staff, but we have some amazing volunteers who are truly committed. This is just a fraction of what you see in the picture, but we encourage everyone, even if you already have Medicare, to please call and just check, because there's no two people that have the identical situation. You know, the same illnesses, take the same medications. You want to make sure that your doctor is participating in the network and your drugs are on the approved formulary or list of drugs. So it's very, very individual counseling that's needed to make sure that the right decision is made for you versus what everybody else has and you join along with them. So this is the value of our services, and we thank you so much for allowing us this opportunity to share a little bit more about what we do. And we couldn't do this without the support of our amazing director, Caroline Cadirao. So I just want to send out a shout out to her as well.
Yes, thank you very much.
Thank you.
Lani, you had mentioned volunteers, and our board is made of volunteers. So how does one become a volunteer with SHIP? What kind of training?
Well, I would strongly encourage everyone to visit our website. We have a ton of resources there, and we have an interactive portal where you can actually submit either a request for counseling, you can submit a request to learn more about volunteering, and we'll contact you and share a little bit more about the different roles that we have, review your time commitment, what might be of interest. We have various roles from information distributor. We have folks who take our flyers to their curves class and so forth. We have exhibitors, we have presenters, we have counselors, we have complex issue counselors. We have an array of roles that are available, and the types of roles are actually growing. So we are building our group of Medicaid specialists just because the need is there and so many people are calling for that type of help. So please either call us and ask for someone to call you back regarding a volunteer application and learning more, or you can submit an inquiry through our website.
Excellent. Thank you very much. Really appreciated the presentation. Learned a lot. Thank you so much. Caroline, thank you. You have a great staff helping all of us. Really appreciate it. Mahalo.
Thank you so much,
Thank
everyone.
you.
I am
And-
now going to bring in, let's see, I'll wait for SHIP to
Thank you
log
so much,
out,
everybody. Thank you.
and then bring in Tati.
For that. But thank you very much for having me. First of all, it's a pleasure to finally visit with your council and those of you who are interested in Medicare and also what HMSA offers as well. I know you already listened to Candace from SHIP. I'm really familiar with the SHIP folks, with Candace and Wanda, Steve and Jane, a couple of our HMSA alumni that have retired actually volunteer at SHIP right now. And I had a really nice time at a Pauhana at a Lanai community event with Wanda. After we got done with the community fair, we went and had dinner afterwards. So really familiar with SHIP. They're a wonderful organization of volunteers. We appreciate everything they do for the kupuna, and we're always partners with them. So we appreciate them very much. And hopefully they feel the same way about us. So let me introduce myself. My name is Tati Guzman. I've worked at HMSA for 15 years, always with the Medicare line of business. So I have a soft spot for kupuna. That's why I chose this line of business. I don't really know a lot about the other lines of business, and Medicare I kind of have a soft spot for. So that's the reason why I always enjoy an opportunity to get to talk to people about Medicare, that very complicated journey, to try to simplify things a little bit and try to do what we can to do what we can with HMSA's Medicare products and try to improve them over the years. We've really tried to make improvements with what we're also be able to offer. So I don't know how much of this is going to be repetitive of what SHIP has shared with you. Hopefully I won't conflict with everything they say. If you go to the next slide, let me go ahead and let you know what I'm going to be sharing with you today. So what I want to share with you today is pretty much what Medicare is. I know that they've gone over the basics already, but you can never get enough of Medicare basics. And really, even if you're over 65 and you've had Medicare for a while, it's always really good to check in every year, because especially now, lots of changes with Medicare that are beneficial to you. Lots of improvements with Medicare beneficiary benefits that the current administration has put in place for this year as well as next year, and hopefully in the coming years it will continue to improve. So even if you have had Medicare for a while, you got your Medicare in your handbook, make sure it's always current. We have a new one every year. Very important you stay on top of those very important changes so you know what your benefits look like. Then I'm going to be talking about when to enroll and how. So they've probably gone over that as well as some of the late enrollment penalties you need to know about. That's very important. I'm going to cover that. What to do if you're still working when you turn 65, which is most of us usually work past 65 unless you're really fortunate or have planned really well. Most of us work, we turn 65 while we're still working. There's some decisions you need to make and some things you need to think about, timelines, things like that. after you're 65, what are the kind of things that you need to do, ask yourself, think about, and plan for, and think about what those timelines are, because CMS is very timeline driven, so it's very important to know what those timelines are. So we're going to talk about that. And then when you're ready to retire, also, what kind of shopping do you need to do? What kind of plans do you have in place? What are your options? What do you need to ask yourself when you're looking for health care? What are the things you need to think about? And you can change your mind every year. You're never stuck with your plans. So, but you do need to ask yourself very important questions every year to make sure that you have the right plan in place as the years go by. So let's go ahead and go to the next slide. And we're just going to start with the very basics about Medicare. So we already covered this already, but I'm going to do it again. So what is Medicare? It is federal health insurance, and it is for people that are age 65 or older, or as I like to say, 65 or better, because I too am over 60 and I feel like I'm getting better. In fact, today is my actual birthday. I was born on Easter Sunday of 1962, which is April 22nd. So today is my birthday. 65 or better. You can also be under 65 with certain disabilities. You can be any age with end-stage renal disease. That's kidney failure or dialysis, also known as ESRD. You can also have Lou Gehrig's disease, better known as ALS. So very simple eligibility requirements for original Medicare. You see that red, white, and blue card, very familiar with that. Very important to have this always updated because it'll show the parts that you have and the effective date that you have those parts A and B. Very important to have that because you'll need that when you go to shop for a Medicare Advantage plan or other type of Medicare product. Okay, next slide, we're going to about the parts of Medicare. And so this is kind of what makes things so complicated about Medicare. It's divided in all right, so we're going to talk about original Medicare. And when you use the term original Medicare, you're only referring to parts A and part. Can you hear me okay now?
I can hear you okay now, so you're good to go. Why don't you go from there and
I'll continue.
Yeah.
Okay, we'll start with this slide then. We're talking about the parts. Right? What are the parts of Medicare? We're on that slide.
Right.
So when you hear the term original Medicare, we're talking about only Part A and B, and you enroll through Social Security. Now, Part C and D, you enroll through a private insurance company. So I want to cover each of these parts, what they cover, and what they don't cover. That's also very important to know. And then how much they cost, because each of these parts may include a premium, a deductible, and co-insurance. So it's important to know these parts and what the differences are with the parts. So Part A is anything that's inpatient hospital. So you spend a night or more in a facility, that would be covered under Part A. I'm actually going to go, when we get to the next slide, I'm going to cover in more detail what's covered under hospital coverage under Part A. Part A for most people is premium free because if you or your spouse has worked 10 years or more in the U.S., then you enjoy premium-free Part A. So when you enroll in Part A, you won't have any additional premium, and it will coordinate with whatever coverage that you already have in place. Okay, so that's important to remember. Part B is outpatient or medical coverage. So that's anything that's not inpatient. So we're talking a lot of different things. We're talking about doctors, specialists. We're talking about diagnostics, testing, x-rays, durable medical equipment like canes, walkers, or wheelchairs are covered under Part B. And Part B does have a standard monthly Part B premium. It's set by the government every year. It's different every year. Usually goes up. Every once in a while it goes down. Right now in 2024, if you're to enroll in Medicare Part, the cost for the standard Part B premium is $174.70. So $174.70 if you're enrolling in 2024 is the standard. If you have a higher income, however, the Part B premium might be higher for you. So what Medicare does is they take a look at your tax return from 2 years ago, and if your modified gross adjusted income you filed with in your taxes was $103,000 or more in that calendar year, then your Part B premium will be higher than that $174.70. If you fall into that category, then the Medicare will let you know. They'll notify you what your Part B premium will be, but the standard is $174.70 for 2024. Both of these parts A and B also have a deductible that's associated with it. Part A, every time you go into an inpatient facility, there is a deductible of $1,630 for every time you enter a facility. Okay, so there's that deductible, and Part B also has a deductible of about $240 now in 2024, so an annual deductible of $240. Important to know those things because that's one of the reasons why people choose other types of Medicare products, to try to take advantage of the things that cover those types of deductibles and costs. Okay, so that's Part A and Part B. You enroll through Social Security. Talk a little bit about Part C and D. We'll start with D. That's the easy one. D for drugs. Part D, prescription drug coverage. And because these are sold through private insurance companies, that means that the price of the plan will depend on the plan that you choose, because all of us, we set our different prices on the different plans that we have. Part D, prescription drug coverage. Part C is also known as a Medicare Advantage plan. And that's a lot of the plans you hear about on TV. That's the type of plan that HMSA Medicare Advantage plans. Those are our Akamai Advantage plans, are Part C plans. Part C plans always include Part A and Part B. They may or may not include Part D, prescription drug coverage, although all of HMSA's plans do cover Part D prescription drug coverage. And again, the price of that plan that you choose, that Part C plan, is going to depend on the plan that you choose. All right, so those are the parts of Medicare, some of the costs and what they cover. Let's do a little bit deeper dive on the next slide about Part A, just to give you a little bit more detail. So what does Part A cover? Part A covers things like inpatient hospital. So when you have a surgery or you have an accident, have to spend the night in the hospital. So this will cover that type of hospitalization, but also covers things like skilled nursing facility. It covers hospice, home health care. Okay, so those kinds of things are also covered under Part A. On the next slide, let's a little bit more about what's covered under Part B. So under Part B, as I said, lots of things covered under here because it's everything that's not inpatient. Doctor's office visits, when you see your specialist, diagnostic testings, x-rays, vaccines, outpatient surgery, like cataract surgery and things like that, walkers, wheelchairs, and things like that, which are known as DME or durable medical equipment. So those types of things, also some blood services, and some medications are covered under Part B depending on how you receive that medication. Okay, so that's going to be Part B. On the next slide, very important to also know what is not covered under Original Medicare. Remember, Original Medicare is just Part A and Part B. So under Original Medicare, they don't cover things like routine vision and eyewear. So if you have a medical condition of your eye, like I do, I actually have glaucoma. I've had it since I was 19. I've had 6 surgeries. I see a specialist every 3 months. That would be covered under your Part B. But when you just go to see a Pearl Vision or Costco to get a regular eye check and get new glasses or contacts, that's not covered under Original Medicare. Another thing not covered under Original Medicare is routine dental. So if you need dental services like fillings and crowns and root canals, that isn't covered under Original Medicare either. Hearing exams and hearing aids, also not covered under Original Medicare. Kind of a shame because these are all things that seem to get worse when we get older, right? But these aren't covered under Original Medicare just now. They're also looking into adding some of these things in the future, which is the good news under the current administration. So let's hope that happens. But right now, those things are not covered under Original Medicare, as well as long-term care, like going to a nursing home, not covered under Original Medicare. And prescriptions, unless they are infused or injected within a facility, prescriptions are also not covered by Original Medicare. And the reason why we need to know these things is because this is the reason why a lot of people choose other types of Medicare products to kind of fill in these pukas and make sure you have a full spectrum of health care outside of Original Medicare. So in the next slide, let's go ahead there. When do you enroll in Medicare? They probably covered this in the last segment, but your initial enrollment period is a 7-month window within which you can enroll in Medicare when you first become eligible, which is usually at 65, and it consists of the 3 months prior to your 65th birthday month, the month of your 65th birthday, and the 3 months after your 65th birthday month. So 7-month window, but important to note that when you actually enroll determines when your benefits begin. So we always encourage people to enroll in those 3 months prior to your 65th birthday month. So as I told you, I was born in April. Today's my birthday. If I were to enroll in January, February, or March, then my benefits begin on April 1st. Okay, so April 1st is when they would begin. If I wait until today, my actual birthday, my benefits won't begin until May 1st. And then as you get into the 3 months after your 65th birthday month, then it gets a 2-month lag and a 3-month lag. So it's really important for you to make sure that you enroll in time so that you'll have the coverage in place when you need it. And we encourage 3 months prior to your 65th birthday month. And for some reason you missed that initial enrollment period, there is what Medicare calls a general enrollment period, which is from January 1st to March 31st, and the coverage will begin the month following when you enroll. Okay, so there is kind of a safety net. And then there's also special enrollment periods for original Medicare. So usually an 8-month period that you can enroll in original Medicare when you retire and different things like that. Medicare has a lot of special enrollment periods that cover times and circumstances where you lose your health care coverage, sometimes out of your control, and they understand that you can't always wait in order to enroll in Medicare. So if you have special enrollment periods just for those particular situations. Okay, let's go to the next slide. Well, I want to talk a little bit about late enrollment penalties. They probably covered this in the last segment, but it's always important to understand what these are, because these are lifetime penalties, basically, because if you are assessed with one of these penalties, then you will have this penalty as long as you have Medicare. So it's pretty much a lifetime penalty. And there's 2 penalties, not just one. The first penalty is the Part B penalty, and it goes something like this. For every 12 months that you should have been enrolled in Part B, but you weren't enrolled in Part B, Medicare can add 10% to your monthly Part B premium. So remember that standard premium is $174.70 this year. Might be more if you have a higher income. 10% will be added to that amount for your monthly Part B premium. The other penalty is the Part D penalty, and this goes down to days now. So if you go days without Part D creditable prescription drug coverage, then Medicare can add 1% for every month past those 63 days. Okay, so if it's 12 months or a year, that's 12% to your Part D premium. So again, important to understand what these penalties are so that you understand how important it is to enroll when you're eligible. Let's go ahead to the next slide. We're going to talk a little bit about what you do when you're still working. So I'm sure I'll still be working when I'm 65, but you turn 65, you're still working. There's still some things you need to keep in mind. What do you do now that you are working, but you're now eligible to enroll in Medicare? A couple of things you can do. Most people enroll in Part A while they're working. And the reason why they do is because if you work 10 years or 40 quarters in your lifetime in the U.S., then you have premium-free Part A, you or your spouse. So you can enroll in Part A that gives you additional inpatient coverage that coordinates with the work plan that you have in place already. So kind of a no-brainer. Enroll in Part A, it doesn't cost you anything extra, and you get additional coverage that works with the plan that you already have. Now, when it comes to Part B, 2 different things you can do while you're working. You can go ahead and enroll in Part B. A lot of people go ahead and do that. They want to get it out of the way. They want to add in additional coverage for the coverage that they already have while they're working. They don't mind having to pay that additional Part B premium. But a lot of people choose to defer their Part B premium because they're working. So if you're working and you have health care coverage with your employer, you can choose to defer your Part B or wait, delay, not have to start paying that Part B premium until you actually retire. So that's usually what people do. Most people don't like to have to pay a payment unless they absolutely have to. But some people just go ahead and enroll in Part B. You can enroll in both Part A and Part B while you're still working and covered under your own plan or your spouse's plan. You could also be covered under your spouse's plan and also defer. So a couple of decisions you need to make while you're working. There are things you need to take advantage of when you turn 65 and you're still working. In the next slide, when you finally do get to retire, yay, happy time. You need to set your retirement date and start planning that party, of course. But you do want to plan ahead 2 to 3 months to make some decisions about your Medicare coverage. Okay, so about 2 to 3 months before your retirement date, you want to take some action so that everything is taking place and set in stone by the time your coverage ends. If you've been deferring your Part B, which a lot of people do while they're working, you want to enroll in Part B so that you want to enroll in time so that you get that red, white, and blue card back in the mail updated that shows I'm enrolled in Part A effective this date, I'm enrolled in Part B effective this date. Now you can use that to enroll in a Medicare Advantage plan or other type of Medicare product. You're going to need that to show proof of your enrollment in Part A and B so that you can apply for those other types of plans. And make sure you also enroll in time for your retirement date. So not only the Part B, making sure you have that updated and you have your proof of coverage for Part A and Part B, but also doing your shopping and making sure that you choose the plan that you think will fit your life best and enroll that in time for your retirement date. So for Medicare Advantage plans, whenever you enroll in a Medicare Advantage plan, it's effective the first of the following month. Even if you were to wait until the 31st of a particular month, as long as your application is in on the 31st, your benefits actually begin on the 1st. You may not have all your information, you may not have your card yet, but according to CMS, the Center for Medicare and Medicaid Services, according to Medicare, you're good on the 1st of the following month. So that's also important to remember. I wouldn't cut it that close. I would give it at least 30 days or more to make sure you have the effective date that you choose, just to be as well organized as possible and to make sure that you don't have any gap in coverage. Okay, so let's go to the next slide. I want to go a little bit deeper dive into what Medicare Advantage plans are, because this is the majority of plans that are out there when you're shopping are called Medicare Advantage plans. Remember, this is a Part C plan. Part C plan is always a Medicare Advantage plan. This is different than a Medicare supplement plan. That's a totally different thing. So I'm going to talk about Medicare Advantage. Medicare Part C plan is sort of an all-in-one plan, and it bundles in Part A and B, so always includes everything that is included under Part A and Part B. You're telling the plan, or you're telling Medicare, I would like for HMSA to coordinate my Part A and Part B benefits on my behalf, so that your doctor will file the claim with us, not Medicare. You come to us if you have issues or questions. You come to us if you need anything at all. So we are going to be your Medicare resource when you join us as a Medicare Advantage plan member. All of our plans include Part D prescription drug coverage. Some plans do not. There are plans that don't have Part D prescription drug coverage. And there's a reason for that, because some people that have a retiree plan that's in addition to Medicare Advantage already have prescription drug coverage. So they want to try to find a Medicare Advantage plan that doesn't have Part D prescription drug coverage. That would be duplicative. But all of our plans bundle it all together. We have Part A and Part B. We include prescription drug coverage. And then we put in extra benefits. And those extra benefits are usually to fill in those pukas we talked about that original Medicare has. So let's go ahead and go to the next slide and talk a little bit about what some of these extra benefits might be. And not necessarily HMSA only. A lot of plans, as you shop, you will see that they will provide these types of extra benefits that are over and above original Medicare. First of all, our plans do have a low monthly premium, so both on our Oahu plans and our Neighbor Island plan, a $0 monthly premium plan, as well as a higher benefit plan that also has a higher premium. So you have kind of a choice between the types of plans you're looking at. We have an allowance for glasses and contacts. It's $300 a year for HMSA, but every plan has a different allowance. As you're shopping, you can see, what type of allowance is offered. We do offer routine dental services at no additional cost. We have $0 copayment for all of our basic services. I think all of the Medicare Advantage plans have some level of dental services, so that's something you want to shop around for. HMSA also has mainland as well as worldwide travel benefits. Usually with original Medicare, once you leave the country, you're not covered. We do have emergency worldwide travel coverage. And because we're affiliated with Blue Cross Blue Shield, the medical association, the national association, we are actually in network on the mainland, so that's kind of good for us. Also, shopping benefit, over-the-counter shopping benefit for health and wellness products, something that original Medicare doesn't offer. A lot of the plans will offer this type of extra benefit. We have up to $95 a quarter you can spend on health and wellness products, online, in person, over the phone. And then, of course, there's fitness, free gym memberships, home fitness kits, health coaching. It's one of those also added extras that's covered over and above what original Medicare. So as you're shopping around, try to see the level of benefits you get with some of these extra things that are offered by your plans. On the next slide, I just want to talk a little bit about how you want to choose your plan, because it can be so confusing with all of the choices out there. So there's some things you want to think about. What's your overall health like? And has it changed at all in the last year? Because remember, you can change your mind every year. You're never stuck with the plan forever. You can always change your mind. That's the best thing about annual enrollment period from October 15th to December 7th. One of the few things that doesn't change with Medicare is that open enrollment period, October 15th to December 7th. So you have a chance to always change your mind if you need to, or stay with the one that you have. But you want to think about what's your overall health. You're someone like me. I have to see a specialist every 3 months. I have very expensive eye drops I have to use. And I want to make sure, I may already know that I'm going to need new eye surgery in the following year. So I'm going to make sure that I'm going to choose a plan that's going to provide me with those kinds of services at a lower out-of-pocket cost. So as I'm doing my shopping, I'm thinking about that. If I look at my brother, who's 4 years older than me, but way healthier. He's an ultra marathon runner. He has no medications. He has no chronic health conditions. I think he wears glasses. That's the only thing that's wrong with my brother. But he probably can maybe afford to pay less on a premium because he doesn't really have to worry about any deductibles or out-of-pocket costs because he's super healthy. He only sees his doctor once a year. So think about what your health needs are, your specific health needs, because you can really find a way to choose the plan that meets those specific needs. How often do you see your doctors? Is it only once a year like my brother, or is it every 3 months like me? Medications, do you have ongoing medications, high blood pressure medication like my husband takes on a daily basis? I have 3 different eye drops that are very expensive. I want to find a plan that would have a good co-payment for those medications that I take. So you want to take a look at that plan's formulary or list of covered drugs to find out if they cover your drug and how much you'll be paying out of pocket for that. Do you have regular activities or health goals? If you really want to get fit this year, that's going to be your goal, then choose a plan that has a fitness benefit. You get a free gym membership. Don't have to pay anything extra. Maybe that gives you a home fitness kit where you can get a free swimming kickboard and go swimming and try to get in shape there. So what are those activities that you're into? And maybe some of those activities are kind of risky. That means you may be at risk for twisting your ankle or having maybe an emergency situation like my brother does, because he does his ultra marathon running. He does, rock climbing. He does the cross-country biking, and he actually did face plant once and had to go to the hospital. So think about what your activities are, what kind of coverage will you need in case you have an accident. And of course, most importantly, what fits within your budget. We're all on a budget, and some years are tighter than others, depending on our situation. Obviously, you want to choose the plan that fits into your budget. So these are some of the things you want to keep in mind as you're moving forward, trying to choose a plan every year. And never be afraid to come into one of our HMSA offices, talk to somebody about what your needs are to see what may be available for you. So on the next slide, let's go ahead and let you know that if you have questions about Medicare, unfortunately, HMSA does not have access to your Medicare information, but I'm sure you got this information before, but you can contact Medicare and Social Security with these numbers and get those. And if you have questions about your status, your eligibility, when you should enroll, your Part premium, if you have a late enrollment penalty, and things like that, those are the people that you're going to want to contact in case you have those kinds of questions. And on the next slide, if you want to learn more about HMSA, we would be happy to host you. If you belong to a company that would like for us to come and talk about Medicare, I'm always available. I love to come out and talk to people about Medicare. But you can give us a call. I have the numbers here. Give us a call. We have local call centers, one in Kapolei and one in Honolulu. We do have a call center on the mainland, but they're only for weekends and after hours. So if you call us Monday through Friday between 8 and 5, you'll get a local call rep that can answer your questions, can enroll you over the phone, and find claim information. You can also walk into one of our neighborhood centers. So we have neighborhood centers statewide. We have one here in Honolulu on Keomoku at our HMSA Center. We have one in Pearl City by my house on Kuala Street near the Foodie Farms, the Foodland Farms. We also have one in Hilo, Kahului. We have one in, we also have one in Hilo, Kahului. We have one in Kona. And I think that's it. Yeah. Okay. Yeah. So come see us in person. It's kind of nice sometimes to talk to someone in person, face to face, get your questions answered. They can enroll you in person. They can look up your account and see what kind of activity you've had. They can get you a provider directory, a formulary, everything that you might need. Or you can also attend the workshop. I also give monthly workshops about pre-retirement and Medicare. I do those once a month. And then when an annual enrollment period comes, we have them almost every week somewhere in Hawaii. So I would love to see your faces at a workshop. We're doing them right now once a month in each of our HMSA locations. So I would love to see you guys in person. Are there any questions that you have for me? I'm sorry for the technical difficulties, but I know I covered a lot of information, but I'd be happy to answer any questions you might have.
No worries about the technical difficulties. We've had that happen before. Lila Mower, yeah, Lila had to depart. Actually, she had some emergency come up, so I apologize that she had to leave the meeting. So I'll wrap up the Q&A and then the end of the meeting. And I just wanted to mention,
great.
Yeah, I wanted to mention we have one of our directors is on this meeting through my cell phone. She had some difficulty. She's on the mainland, so she had difficulty getting on. So I've got her on my cell phone by speakerphone. So she might have a question. Actually, I'm going to ask Helen. I don't know if you're able to speak. I don't know if you're able to. Hold on a second. Hold on a second. Okay. 2024. Okay, I'll ask the question, the same one you had before. So I'm going to ask a question for Director Helen Wagner. She wanted to know why the telehealth program is ending this year the way it is established currently. If you can answer that.
HMSA, as far as our Medicare Advantage plans, we are not ending our telehealth. We're not ending our telehealth benefit. We're continuing with our $0 copayment for telehealth. And for Medicare Advantage members, it is a $0 copayment for the entire duration of the appointment. Now, for commercial plans, I can't speak to the commercial plan. So if you're working right now when you're on a commercial plan or a group plan that's not a retiree plan, I'm not sure what they're doing as far as changes for telehealth there. But for our Medicare Advantage plans, we're going to continue to use telehealth visits as well as our HMSA's online care, which is another way you can do that. Both at $0 copayment for the duration.
I believe the ending of telehealth was 2025, and that was an end by Medicare itself. So Medicare itself will not cover telehealth. But I guess.
Oh, okay, because we're in the middle of, we're in the middle of designing our plans for 2025. So this is the time of year where those of us who are on the front line and talk to folks can say, you know, people are asking about this particular benefit. Can we make sure we keep this, or can we add this? People are asking about hearing and things like that. So I'm going to ask them about that. To my knowledge, we weren't planning to remove telehealth from our Medicare Advantage plans, but I can find out and get back to you on that. The final decision for how our plans will look in 2025 will be made by June, probably the first week of June. We have to turn it into Medicare then. So by that time, I'll know for sure if we're going to continue to do that. But to my knowledge, in the meetings I've been in, we haven't discussed anything about removing telehealth at all for 2025.
Let me ask
Go ahead, Doug, you have another question.
let me ask a kind of a leading question. Since you're here on behalf of HMSA, why HMSA rather than another carrier?
Why HMSA? So, but there's lots of reasons why. We obviously been around for 85. We just actually celebrated 85 years as the local partner to the community just this past year. So 85 years, we have a lot of experience. I mean, we do pride ourselves on being the local company. That is one reason. But we do have a lot of extra benefits that we have added in the last couple of years to improve our plans. We have a $0 monthly premium for people on a budget. We just added that maybe 2 years ago. We added dental last year. This year we added a shopping benefit. So every year we're really trying to listen to our members to see how can we make our plans better. We're always trying to be a good partner to our community members as well as our Medicare Advantage members, really trying to make sure that we are there for people during this really complicated journey of Medicare. So again, extra benefits, fitness, travel, and things like that. We just love being the local company, and we appreciate all of the loyalty that members have shown us over these 85 years.
Hey, thanks.
Okay, I have a couple of questions. One of them is from Helen. She just passed it on to me. So Helen would like to know if there's any program that you have that covers acupuncture.
Yes, so in our Medicare Advantage plans, we do not have routine acupuncture. So I'll be completely transparent with that. And every year, I ask our people that that design the plans, can we add acupuncture? Because I know that it's something that's used a lot here in our community. We're not adding it yet for 2025. We only have the acupuncture that could possibly be covered under Medicare. So we do not have an acupuncture benefit.
Okay. And then, well, I also wanted to say happy birthday. So I know we were doing it in the chat, but if we knew it was your birthday, we would have maybe baked you a Zoom cake or something. I don't know how we would have. Sometimes we have these meetings in person, and we would have, if we knew that, we would have done something for you. But in any event.
That's sweet.
Yeah, happy birthday. And then I do have a question that I also asked to Ship, but actually I'm a little more concerned about the possible outcome now. So I proposed that, this is the scenario, and it's a real life situation in my home where I live. I live in a high-rise condominium, and we've got a kapuna here that I met recently. And he told me he doesn't have health insurance. He's in his mid-70s. And I asked him, how come he's not on Medicare? And he indicated that something to do with Social Security. He wasn't really contributing to Social Security when he was younger, so he really didn't get that benefit. I wasn't quite clear on that, but I just let that part of the conversation go. So I found out from Ship that and from you that the enrollment period is from January 1st through March 31st. But with his age and the fact that he's never applied for Medicare, it sounds like there's a penalty from what you were saying. And it could be substantial. So say I don't know his exact age, but say he's 75, that would be 10 years of a penalty if I got that correct. Could you clarify that for me?
Yeah, that would be correct. So if he has not enrolled and has never been covered by other types of healthcare coverage at all, then that late enrollment penalty would apply, unfortunately, and it would be quite costly. It might be even less for him to look for an Affordable Care Act individual plan rather than enroll belatedly into Medicare because of that late enrollment penalty. He'd have to see, I don't do math very well in my head, so I don't know, I wouldn't be able to add up 10% of however many years, 15 years, to the current Part B penalty, or if he has a higher income in the past, and it would apply to that as well.
We lost you momentarily here. Okay, she muted. All right, I know that I don't know if there's background noise, Tati, or what's going on, but occasionally we have that static. So let me ask, while you're muted, let me ask if there's any other questions from any of the other participants today before we end. We're right almost at the exact 1 o'clock mark, so we're a minute away. And if I don't see any other questions, I know there's a little bit of static there, so I'm going to let you stay muted just for a moment, and I'll bring you back if you can come on in a second. But I am going to just thank Tati Guzman for participating today. I want to thank earlier too. I know they're not here anymore, but I do want to thank again the participants from SHIP. And I really want to thank you, Tati, because you actually gave us a lot more information in certain detail that we didn't have earlier. So we had a different level of an overview, and you gave us some additional supporting information. And I do know there's additional plans and benefits for wellness and other things that are part of what HMSA and other insurance carriers are providing. So we appreciate that additional information. So I want to thank you on behalf of Kokua Council for participating today. And if you want to try to unmute just so you can make a final statement before we go, let's see if that works. I don't know. You want to see if you can unmute?
Yeah, I muted her when we got the static, and I have a ask to unmute button, so she's probably hearing us but unable to
Yeah.
unmute. So
Okay, so can you unmute her, or just
I
to
can
see if
only ask to unmute, so which is what I've done.
So Tati, if you can see that and unmute, that's fine. If not, I'll give you a few seconds here. But if you can't, and maybe there is some background noise, I think we'll just end here. I think we appreciate all of the time that you spent with us today, and we really appreciate the presentation for our members. And I'd like to thank again everybody that participated today. And we hope to see you back for our next program. We do have the upcoming the good, the bad, and the ugly. It's a legislative review that's coming up in our May program. So we'll keep you more informed about that. And with that, I'd like to just thank everyone again for participating. And Doug, I'm going to let you just end the meeting, and I'll say goodbye.
Okay, thank you much. I'm going to stop the recording and take us off Facebook. Thanks, everybody. See you later.
Thank you.